Hi, everybody. This is Dr. Sonia McGowan, and we are getting ready to start our webinar on hypermobility and dysautonomia. I'm going to give people just a minute to get settled in. If you have questions, you can leave them in the Q&A box that you will see. For me, it's on my right. So I don't know what your view looks like, but you can find there's a chat box, and then within that is a Q&A box. All right, so let's go ahead and get started talking about hypermobility and dysautonomia. All right, so first of all, let me tell you a little bit about my practice. So I own the Covenant Pediatric Wellness Center in Jefferson City, Missouri. We really specialize in working with complex kids. And by that, I mean, you name it. So any child who's struggling, whether it's a kid with a diagnosis, maybe the diagnosis is autism, ADD, ADHD, auditory processing disorder, dyslexia. Maybe they don't have a diagnosis. They're just really struggling with behavior. They're struggling with academics, socialization, language. I call them round peg square hole kinds of kids who just nothing is overtly diagnosable necessarily, but they're struggling. And we really want to pay attention to those kids because they don't just grow out of things, right? So we do a lot of functional nutrition. We do neurodevelopmental exams. We use very neurologically focused chiropractic, craniosacral therapy. We also have a general pediatrician on staff. So Dr. Hannah Strong is our pediatrician. She has experience in complex kids, lots of experience just in everyday pediatrics. We are about the only clinic, to my knowledge, that doesn't require certain things of babies and children that other clinics require, if you know what I mean. So when parents have strongly held beliefs, we respect those. We also have a program called the Spot for Tots, where we provide comprehensive evaluation and intervention for oral restrictions, so lip, cheek, and tongue ties. We also have a myofunctional therapist and a lactation consultant on staff as well. So we are really the place to come for people of any age who suspect oral restrictions. Our youngest is a newborn, and our oldest, I think, Mervin was like 64 when he came for his tongue tie release. So really, we treat all, we see all people with oral restrictions, no matter their age. We also have an early beginnings program where we offer prenatal and pediatric chiropractic, craniosacral, lactation consultation, feeding therapy. And we do also, even though our name says pediatric clinic, we do have doctors now on staff who will see adults for traditional chiropractic care. All right, so let's talk about hypermobility. So hypermobility syndromes are a group of conditions that are characterized by excessive joint mobility, and with that comes some connective tissue abnormalities. So examples include, for one, Ehlers-Danlos syndrome. We actually have a person on staff with Ehlers-Danlos who is very versed in it, of course, because she has it. And so she's got some expertise around chiropractic and hypermobility. So let's talk about symptoms of hypermobility. So what we mean by this is that they have excessive range of motion of their joints. So we say they're bendy, right? So they can move their joints in ways that, most other people cannot. And this excessive range of motion leads to joint pain and instability, frequent sprains, dislocations, etc. The hypermobility often leads to chronic pain, fatigue, and weakness. It's very common to have a weak pelvic floor because they have the connective tissue differences. Also, again, really common because of those connective tissue differences that there's skin involvement. So particularly in Ehlers-Danlos, and we're going to talk a little bit more about this, they have what we call skin hyperextensibility. So that they can take the skin from their hand or their leg and they can pull it, or they take their neck and they can pull the skin away. Their skin is easily bruised. They have difficulty with wound healing. And very often they have digestive complaints as well. And so Ehlers-Danlos syndrome is a hypermobility situation. There are several subtypes of Ehlers-Danlos or EDS. We have classical EDS, which includes joint hypermobility, skin hyperextensibility, and tissue fragility. It's often really common to see smooth, velvety skin. The skin is fragile, very prone to bruising and scarring. Of course, the joint hypermobility. And then, in particular, Ehlers-Danlos has a genetic component. So this is how it is diagnosed, is through a genetic test. Another type of Ehlers-Danlos is the hypermobility subtype. And so again, we've got the generalized joint hypermobility. We have chronic joint pain. We have the soft velvety skin. The skin hyperextensibility and tissue fragility are less pronounced than in the classic form of EDS. We see, of course, the joint instability. We see frequent subluxations or dislocations. And then, of course, possible genetic contributions. There are other subtypes of vascular EDS, and then, a couple more subtypes that are far less common. So really the two most common are the classic and the hypermobility. So here are some examples of joint hypermobility. So people who can, do all these bendy things, these are really common sort of screenings for people with hypermobility syndrome. So to get a diagnosis, of course, you have to have a physical exam by a qualified medical provider. They will use something called the Baton score. And so this is a standardized assessment tool that measures just exactly how bendy they are. And then genetic testing is part of this picture as well. So the Baton score, there's more to it than this, but I'm trying to give you an overview so that you can recognize this in your children and yourself, other family members, just enough to know if you need to be screened for this. So when you go and you hear the term Baton score, you'll know what we're talking about. So it's just a series of screening tests that look at different joint movements. So passive movement of the pinky, of the thumb, hyperextension of the elbows and knees, forward flexion with knees completely straight and hands flat on the floor. So this is part of that Baton score. So depending on how bendy you are in all of these different areas, the practitioner assigns you a score, and then based on that total score helps them decide, do we need to go further with a diagnostic process? So in terms of interventions for hypermobility, generally it's symptom management. So patients often get pain management services, physical therapy, chiropractic. If your doctor knows about hypermobility syndrome, they need to be educated and experienced because it's a very specific condition, and you want to make sure that you're being adjusted by someone who knows what they're doing. Generally, we have a multidisciplinary team for these patients that may include rheumatology, physical therapy, chiropractic, pain management, etc. All right, so let's talk about dysautonomia or POTS. So dysautonomia is a dysfunction of the autonomic nervous system. So when we talk about the autonomic nervous system, this is the part of your nervous system that takes care of things you don't think about, right? So breathing, heart rate, sweating, things like that. So part of that autonomic nervous system is sort of a division of the sympathetic nervous system, which is also known as fight or flight, and the parasympathetic nervous system known as rest and digest. So what we know about kids with complex needs is nearly across the board, they tend to not have a good balance between sympathetic and parasympathetic nervous system response. Most of the time, these are kids who are really stuck in that fight or flight response. That's why they tend to be not good at the things that are rest and digest related. So these are kids generally who aren't great poopers. They're not great eaters. They're not good at digesting their food. They're not good sleepers. And so it's very common to have an autonomic dysregulation in complex kids. Dysautonomia is a step deeper than that, and we're gonna talk you through that. So we have dysautonomia. We have a type of dysautonomia called POTS, which stands for postural orthostatic tachycardia syndrome. Tachycardia means a abnormally fast heart rate. So again, POTS is a type of dysautonomia. So see dysautonomia as sort of the umbrella, and underneath it we have POTS. All right. So again, POTS is a form of dysautonomia, an abnormal response of the nervous system to changes in posture, particularly from lying down to sitting up. Now, we've all, stood up too fast and we get kind of woozy, kind of, our vision goes a little dark. This is sort of that, but more severe. So the autonomic nervous system is responsible for regulating involuntary bodily functions. So think blood pressure, heart rate, digestion, breathing, etc. And so when you have a dysfunction here, it leads to abnormal increases in heart rate upon standing and inadequate compensatory responses to maintain blood pressure upon standing. So when you have an abnormal blood volume regulation and or impaired distribution of blood flow when you stand up, it will give you symptoms. So many times what happens is, so when you stand up, your venous system is required to push the blood from the lower extremities to the heart. And so when you have POTS, potentially what's happening is your body's not good at returning that blood up to the heart, which leads to decreased cardiac output. So it affects the way how much blood your heart can pump out. And sometimes what's happening too is we have special receptors inside the vessels and the heart that detect changes in blood pressure. We call those baroreceptors. So think barometer will measure the atmospheric pressure, right? So baroreceptors inside of our vessels and our heart detect changes in blood pressure. And so often these baroreceptors don't function the way they're supposed to. And so this leads to the body not being able to modulate the heart rate, the vascular tone, etc., which influences blood pressure. And then this can influence blood flow to the brain, which causes dizziness, fainting, etc. So we have several patients with POTS in the practice, and what they'll say is it's not only, from getting up from lying down, but it's also things like bending over. So I remember a patient saying, I have a really hard time hanging laundry on the line to dry because I'm forever, bending over and standing up over and over again. And that, it's a really difficult thing for her to manage. And so as well, the classic symptoms of I lay down, I stand up, and I get symptoms. All right. So symptoms of POTS include dizziness, lightheadedness, fainting. Fatigue is generally a big part of this, and it doesn't seem to matter how much they sleep or how much they rest. They're still quite tired. An abnormally fast heartbeat, and of course, the symptoms worsen upon standing, really any kind of position change depending on the person. To diagnose this, generally, we look at doing a tilt table test. This assesses changes in heart rate and blood pressure in response to the change in body position. There are some other autonomic function tests, including heart rate variability, a deep breathing test, a sweating test, and then, of course, symptom assessment in the history. So generally, people who we think about potentially having dysautonomia or POTS generally go to cardiology first. Interventions. So generally people are told increase your fluid and salt intake. That's going to help modulate your blood pressure. Exercise, maybe in some cases, some pharmaceuticals for symptom management. All right. Now, MCAS stands for mast cell activation syndrome. This is a common comorbidity or co-occurring condition to Ehlers-Danlos syndrome. So when you have Ehlers-Danlos and you have POTS and you have MCAS, you have what's called the EDS triad. And if you do any kind of research or Googling around EDS, you're going to see a zebra as kind of an icon that is used for EDS. And so that zebra stands for the people who have the EDS triad. So let's talk about mast cells. They're part of our immune system's fight squad. So it's the soldiers. These are the soldiers that are sort of on patrol for things that the immune system should respond to. They are responsible for allergy awareness and allergic reactions. And so when you have mast cell activation syndrome, what happens is that these mast cells kind of go the wrong way. They misbehave. They release these immune mediators spontaneously in error, causing a misdirected immune system response. We don't generally know the trigger, so that it can make it hard to manage and hard to diagnose as well. And so when you have MCAS, what we generally see in terms of symptoms are hives. We see flushing and swelling, shortness of breath, wheezing, vomiting. So all of these things, of course, look like an allergic reaction, but of course, this is deeper and chronic. So in terms of interventions, depending on what's happening, if it's an anaphylactic response, then typically people are given an EpiPen. Mast cell blockers in terms of medications, we can use antihistamines and natural ones as well. Magnesium, antioxidants are helpful. There is a certain enzyme called DAO. It stands for diamine oxidase, and it is a histamine management situation. And so people who maybe have MCAS, who are maybe very responsive to high histamine foods, the DAO supplement, that enzyme, helps the body break that down and get it out of the system. And then, of course, a low histamine diet as well is helpful. So as we sort of tie all of this into kids with complex needs, what we see over and over with families who have kids who have complex issues is when they go for traditional medical help, they're generally told it's just autism, or it's just pandas, or it's just the behavior disorder. So we might have kids who have hypermobility types of symptoms, or symptoms of POTS, or symptoms of MCAS, or you name it, chronic constipation, they don't sleep, they have developmental delays, and they're told, oh, it's just fill in the blank. Well, I'll tell you, it's never just that, right? And so there can definitely be an intersection between hypermobility syndromes and dysautonomia and complex kids. So it can be challenging to assess symptoms, especially in kids with limited communication. And in a typical, neurotypical person, Ehlers-Danlos and POTS and MCAS are a challenge to diagnose. And so it just adds another level when it's a child and when it's a child with complex needs. So often what we find are kids have discomfort or pain. They don't have the vocabulary or the verbal ability to really quantify that or communicate that. So we can't discount the possibility of pain. And you need to be able to find a doctor who's willing to consider all possibilities and run necessary labs. So if you've got a kid who's super bendy, who has a lot of the symptoms we've talked about today, you're suspicious of pain, there are skin manifestations, whether they're hives or skin extensibility. What you don't want is a doc to say, oh, that's just autism. It can't be anything else. They need to be willing to run the labs. They need to be willing to send referrals to specialties like cardiology, for example, or to genetics. And then I encourage you and other practitioners to think out of the box. So consider other potential triggers for symptoms. So, look at the symptom list and think, what else could this be? What could be contributing to it? What could be making a child have a more severe presentation? And so these are the things that I preach all the time, no matter what the potential diagnosis. So we have to make sure that the foundational issues of health are assessed and addressed. So things like nutrient deficiencies, things like mitochondrial dysfunction. Mitochondrial dysfunction is when the body can't efficiently make energy from the food. And so if you don't have enough gas for your car, you can't do higher level things like run your windshield wipers, right? And the body is the same. So if the body can't make energy inside the cell, we can't have a stable immune system function, we can't have stable cardiac function, we can't have good digestion, etc. So that is something that definitely needs to be assessed and intervened upon if we find it to be true. Intestinal dysbiosis, so malabsorption due to maybe a yeast overgrowth, a bacterial overgrowth. Mycotoxin exposure or mold toxin exposure can mimic particularly POTS symptoms. I'm actually in the process of managing a couple of cases right now. Same gal who talked about the trying to hang her wash on the line, the up and down gave her a lot of symptoms. So POTS was number one on our list, but what we have sort of figured out over the course of the diagnostic process is she has quite a heavy load of mold toxins. And so it's important that we clear that out as a potential cause of symptoms so that we know what we're actually dealing with. So we can either rule POTS out or send her on for further diagnosis. Environmental chemical exposure can be quite a trigger for a lot of kids. It seems like kids with complex needs are just sponges for toxins. And so things like, plastics, things like pesticides and herbicides, glyphosate, things like that can really muddy the waters. And so sometimes that is an appropriate thing for us to test for and look at to make sure that we're addressing all potential contributors. The other thing to think about is tick-borne illnesses. So we're seeing just so much tick-borne illness right now. And in some kids and adults, it's manifesting as a condition called alpha-gal. So alpha-gal is an allergy to certain meat products. And this allergy is triggered by a tick bite. And then, of course, we have Lyme disease. We have all the Lyme disease co-infections. And so this is, it can be a challenging thing to figure out, but we have some options for really good and easy testing to rule out any kind of tick-borne illness as well as alpha-gal. So if this sounds like your child, or someone else in your family, we do have docs here with training and experience in mast cell activation, hypermobility, POTS, Ehlers-Danlos, etc. We can offer functional nutrition to assess kind of those co-occurring issues like deficiencies, mitochondrial dysfunction, intestinal health, etc. If your child is experiencing additional things like digestive problems, sleep challenges, behavioral challenges, we have holistic care for that. We have the ability here to do full laboratory workups. And then, of course, we have our holistic and medical doctors on staff who can help manage those interventions, who can give referrals to the appropriate subspecialty like genetics or cardiology. So what's important for you to walk away with is don't just let someone discount that one of these situations are not happening with your child. If you feel like, they're checking a lot of boxes in terms of hypermobility, dysautonomia, etc., definitely talk to your doctor about it. Find a doctor who's going to listen to you and do the appropriate tests. So here's our contact information. These are all of our providers. Again, we're in Jefferson City. If you have specific questions, you can always email me. You can have a look at our website as well and follow us on socials. You want to be sure to keep a radar on the webinars that we do. So I do one the first Friday generally of every month. So on June 7th, our topic is pans and pandas. And also, you'll want to be watching for our blog posts as well. So watch socials. We always let you know when a blog post has dropped. We generally do blogs releases every other Monday. Because we have, such a lot of topics this month on the hypermobility, the dysautonomia, et cetera, we actually have one blog post a week. So if you're interested in this and you want to learn a little bit more, this was just a cursory overview. We do have some blog posts that are going to go into more detail about each of these topics. And so I believe the first one is published today. So you can look, we have a sister website called thewhymatters.net. And that's where we house our webinar replays. It's where we house our blog posts as well. So be expecting some social media posts about this as well. So if you have any questions at all, always just feel free to email or send us a message via social media. So, all right. Last call for questions. If anybody has any questions, go ahead and drop it in the Q&A box right now. Otherwise, we will see you next month, June 7th on Friday, to talk about pans and pandas. So, all right. Well, guys, I hope you have a great week, and we will see you for the next webinar in June. Have a good day.